I think the
because
chat
the
becomes,
transcript's included. Okay.
yes. Okay, so we are recording. And you're right, I see the transcript on the side. Okay, so welcome. What I would love to do first, well, let me just really quickly, I'll go over the agenda. I do have some slides, which I will share at some point, but I want at first to just have us on screen. So agenda I put out through email, but we're going to do welcome and introductions. We'll do a project overview. We'll talk about the different partners who are involved in our project. I want to just give a chance to orient you to what is this that you've agreed to be on an advisory committee for. We'll talk a little bit about some of the core activities, and then we'll get into what is the role of an advisory committee, and I'd like to actually talk through some group agreements, which we can revisit as we get more people to join us, but I think that's an important thing to do as we're kind of forming this group. And I welcome questions and input through the conversation, and we'll give space at the end also, just to make sure that people have a chance for that. And then we'll talk about next steps, which really is figuring out, not that we'll get out our calendars, but just talking about kind of the future meetings and how we'll go about planning those. Does that sound good? Great. Okay. So let's do introductions. I'll start, and then I'll just kind of call people if that works, so that we don't talk on top of each other. And then I'll cover who else is on the committee but isn't here yet, and who we're still hoping to identify to join. So, like I said, I'm Laurel Omland. I'm the director of the Child, Adolescent, and Family Unit at the Vermont Department of Mental Health. And then for this project, I'm actually the project director on record with SAMHSA. So really just like kind of taking responsibility for what we've proposed and the budget and all of that. But then we have folks who are, helping carry all that out. So first I want to introduce Mariana. You want to go ahead?
Sure. Hi, I'm Mariana Donnelly. I also work at the Department of Mental Health under Laurel, and I coordinate school mental health. So I oversee a couple grants, Success Beyond 6 and Project Aware, that brings mental health into schools.
Thanks, Mariana. And then Tracy.
Good morning. I'm Tracy Watterson. I work at the Agency of Education. I'm the Assistant Director for the Student Support Services Division and the Vermont MTSS Program Manager / Team Lead. And I am the agency's point of contact for the Project Aware grant, and will be supervising our Project Aware coordinator, which we're in the process of hiring.
Yes, and we're in the process of hiring one for DMH as well, and Mariana will be supervising that person. Okay, so now I'm going to go around the circle. So Shalini.
Oh, it's actually Shalini?
Shalini, I'm sorry. I will get it. Sorry,
Sure.
Shalini.
My friends in grad school used to tell me to tell people it sounds like colony, Shalini. I just don't like that association with colonization. Yeah.
Agreed.
So I'm Shalini Soriana-Raina. I am working in our first ever Vermont Office of Racial Equity with Susanna Davis, and Susanna's on leave right now, so I'm stepping in for her. But I'm sure once she gets back, she'll be joining the group as well.
Thank you. Bernice joining. Thank you. Michelle?
Hey, good morning. I'm Michelle Salvador, and I'm the Adolescent Health Program Manager at Family Child Health at the Health Department. And I manage a couple federal grants, and I sit at all tables having anything to do with adolescent health.
Glad to have you here. Thank you. Nancy.
Good morning, Nancy Helen at the Agency of Education. Sorry, my voice. I am on the Vermont Multi-Tiered System of Supports team, as is Tracy, and I am have the opportunity of being involved in family engagement at the agency.
Thanks, Nancy. Kate?
Hi, everyone. My name is Kate Paxton. My pronouns are she, her. I am the Associate Director of Health and Wellness for the Burlington School District. And glad to be here. I know some of you and a few others are new to me. So I'm glad to see you all and be part of this group.
Thanks, Kate. Melissa.
Hi, I'm Melissa Senegal. I'm the Director of Curriculum Instruction and Assessment for Southwest Vermont Supervisory Union in Bennington. We have 10 schools from Arlington down to Pownell. And I also co-lead the MTSS team, district team, with our assistant superintendent here. I work closely with our equity coordinator, and I'm the EL coordinator for our district. And are very proud to say that we have a project aware coordinator, Lindsay Heller, who invited me to join this team, and I'm working closely with her. So I'm excited to see what this work can do.
Thanks, Melissa. Glad to have you. Bernice, I know you just hopped on, but you probably got the sense of what we're doing. So if you could introduce yourself and welcome.
Morning, everyone. Sorry, I was sitting on another Teams link and realized that I was probably in the wrong space because no one else was there. Morning, everyone. I'm Bernice Garnett. I'm a faculty member at UVM in the College of Education and Social Services. My background's in public health, and I do a lot of school health related research and programming. Most specifically, probably connected to this group is work with the Agency of Education on community schools implementation and evaluation connected to Act 67 that was passed in 2021. And I'm happy to talk more about community schools as it might relate to this work.
Thanks, Bernice. Welcome. Ann Keeley.
Hi, I'm Keely. I was invited to this meeting as a parent rep. So I think, yeah, I'm a parent for this purpose, these purposes.
And which school district?
SVSU.
Okay, great. Thank you.
Yeah. Yep.
So I'm actually going to share my screen because I want to show you the list that we have of the committee members and just let you know who some of the others are who weren't able to join us today. So bear with me, and then I'll dive right in from there to some of the other slides. Just give me a second to reorganize so I can see you and the slides. Do you all see that listing?
Yep.
Great. Okay. So this is our list. And we have Heidi Schumacher, who comes to us from UVM's Vermont Child Health Improvement Program. She's assistant professor of pediatrics. She also came to Vermont from DC and had actually been connected and helped to run the Project Aware initiative down in that area. So we're really thrilled to have her as a part of this advisory committee. She brings a lot of perspective around youth and pediatric health. Great, we have Karen joining too. But she unfortunately she knew she wouldn't be able to join us today, and I figured she's familiar with Project Aware, so it might be okay to have her miss, but she's looking forward to joining the committee later. And then Rob Evans was really hoping to be here. He unfortunately isn't able to make it, but he is a partner with Agency of Education and runs this Vermont School Safety Center. So some state folks might know him. I know some of you do, but wanted to make sure that we have that connection with the work that's happening around ensuring schools are safe and linking that with knowing that social emotional mental health supports is a part of that. So he will be coming, and then Karen just joined. I wanted to give you a second to hop on, but Karen, we are doing introductions. If you want to unmute and introduce yourself, that would be great.
So hi, I'm Karen Price. I'm co-director of family support at the Vermont Family Network. So VFN is the parent center in Vermont, and we work with parents of children with disabilities, the full scope of disabilities. So that does include mental health, as well as all of the disabilities that are defined by IDEA.
Thanks, Karen. Appreciate you joining us. And then Emily Reynolds also sent her regrets for today. Keely, for some reason I had you down for CCSU, and I knew that seemed odd, but I will change that. So sorry about that. And
No
then
worries.
we're waiting. I'm sorry?
No worries.
Okay. We are hoping to still identify a parent rep then for CCSU, and then some other members from the leadership teams within the Barrie district and the Caledonia Central district. And then that's all of us. So that's our group. And again, really appreciate your interest and willingness to support us in this project. I should say, and it's at the bottom here, I'm going to get into a little bit more about, SAMHSA and our funding and what this project is, but there also is a request that not only that we have an advisory committee, but that there's student voice. And I and our team was somewhat concerned about having a or two students on an adult majority committee. That just doesn't feel right. So we are actually consulting with Vermont After School, and then in particular Matt Wolf, around what are some great strategies for engaging student input and student voice. So we will be talking about, are there particular questions or areas where we want student voice, and then working with the school districts that are involved in the project to bring questions to groups of students that they might have, and help identify how to do that and get their input in that way. There are also other groups of youth that, as Michelle just put in the chat, that different entities have connections with. And so I think we'll just keep talking about, this might be a good topic to bring to Vermont Raise, or there is the governor appointed youth advisory committee. So we want youth voice. We just want it in a more authentic way, and to be intentional about when we're asking for their input. But that's also something that I think is helpful to hear from you all of, have we thought of, help us see where and when to best do that in an effective way. Okay. I'm going to do kind of some high level overview of the project. I grabbed a couple slides from SAMHSA, the Substance Abuse and Mental Health Services Administration. They are the federal entity who's funding us for this project. And they had some kickoff webinars with us, and I figured, why not convey their message to us, to you all as well. So just the excitement about this next, we are joining this year's cohort of Project Aware, but there are multiple cohorts. And in fact, this is the listing of the 2023 grantees from across the country. And you can see it's not just states who are awarded it. In some areas, it's a school district or a tribal entity or a county level. So there are all different entities who are joining this. And this is just the 1 year of awardees. They have this map showing kind of where are all the awards for the last 5 years. And we actually had been on this map before because we received the award in 2018. And it was awarded directly to Vermont Agency of Education, and DMH was the partner with them at that time. And then we've kind of flipped it for this round. But just wanted to kind of put it in context of, there are these other folks who are involved in this, and that means that we have some peer groups that we can do some outreach to, and engaging in some just peer-to-peer exchange of, how are you dealing with X? Or we can pose questions out there, or respond to questions that others pose.
Can you show that previous slide again? I didn't get a chance to see those. Oh, there we go.
Yep. And I can send out the slides afterwards as well.
Oh,
so
perfect.
You can review
Thank
these.
you. That's fine.
Glad to. Okay, so what is this? As I said, SAMHSA, or the Substance Abuse and Mental Health Services Administration, this is an award through them. Project Aware is actually an acronym, so it's Advancing Wellness and Resilience in Education. It is a $1.8 million federal award per year for 5 years. So it functions on the federal fiscal year, which starts September 30th. I don't know why they picked that instead of October 1st, but it's September 30th through the September 29th of the following year. So it will go until 2028. As I said, we are the recipient at DMH, and there's an expectation of all of these awards that regardless of where it's held, there has to be involvement of the state education agency, the state mental health authority, and at least one local education agency. For us, we have 3 LEAs involved, and they're partnering community mental health agencies. And there is an expectation of the coordination with mental health for all sites. We just wanted to really formalize it. So our 3 local education agencies, which is kind of that generic term for school districts or supervisory unions, we have Barre Unified Union School District and their partnering entity of Washington County Mental Health. We have Caledonia, that's a misspelling, Caledonia Central Supervisory Union, and their partner of Northeast Kingdom Human Services. And then Southwest Vermont Supervisory Union and their partner with United Counseling Services in the Bennington area. This is a lot of words. You'll be able to read this later, but really the purpose of this grant, this is not a service grant. So SAMHSA is not funding us to provide direct services to students. They're funding us to work on infrastructure and to try to create some lasting system change with school systems and the partners within community organizations to really make sure that we are understanding, recognizing, identifying, and responding to student social, emotional, and mental health needs. So part of this is about educating the adults, both within school systems, but also in the community, including families, about what are social, emotional, mental health needs that our youth face. It's about how do we identify those? And so part of this initiative is going to be either selecting and implementing a universal screening tool for social, emotional, behavioral needs, or in the case of SVSU, who already has one, enhancing their use of it, and because they merged with another district, expanding it to those other schools. And then how do we use that data? How do we understand from the data of a screening tool, what are the needs and how are we leveraging our multi-tiered system of support to meet those needs at all those levels? So what does every student need? What are the risks the students with risk need, but what are those risk areas or themes within the school or certain classrooms or certain populations of students? And then what are those who have some identified mental health needs? How are supports happening for them? What are the protocols within schools to review the data and respond to the needs as they're identified? And there's an expectation that we have crisis protocols really clearly in place so that if there are suicidal concerns or other risks, that the schools know how to respond to that and who can they pull in to meet that. And that's, again, where the connection with the Vermont School Safety Center is important because, like I said, with Rob Evans, we want to make sure that we're clear about what's a threat assessment process and what is a mental health or other type of crisis, and what are those responses. So that's a lot of work that we have to do, but we have 5 years to do it, and we have some great partners to help us do this work. I'm going to pause there and just see if there are particular questions or comments before we get into some of the other stuff. Okay, there doesn't have to be. I just want to give space for it. The next slide I have really outlines the goals of Project Aware. And again, these are our Vermont goals, but they are really SAMHSA's goals. It's really about how we take these broad goals and then put them into action. But I just talked through a lot of this. But so you can see what the goal and phrasing is from SAMHSA and their expectations of us. So increasing awareness among youth, increasing mental health literacy among adults, basically is the second one. Promoting and fostering resilience and mental health well-being. So how do we provide those kind of supports for everyone? We're not just trying to intervene where there's problems, but trying to strengthen wellness in general. Taking that multi-tiered system approach and then connecting people with the supports, making sure they actually get access and trying to figure out what are some of the access challenges. We know what some access challenges are. The existence of the resource to begin with is one, timeliness of responsiveness, all of that. So those are things that we'll be working through. Okay, so who is involved? We have our state team, as I mentioned, and you've met some of us. We have our sites, or the regions where the work is happening. So the designated agencies, the school districts, and then you will hear some terms as we get into this, DCLT, or our district community leadership teams. This is a maybe new phrasing, I think, for school districts, but we really want to be bringing together the school system and the mental health system in those local regions, and the leaders to be thinking together about what are the needs, what are the existing resources, where are the gaps, how do we figure out supporting and addressing those gaps. So there's some support that we'll be giving to those regions about what is a DCLT, how do you do this work, what kind of agreements need to be in place, and how to lead that. We have a project evaluator that was identified through our state procurement process. I'll get into it in a little bit. We have a technical assistance entity, we have some trainers, we have you all as an advisory committee. And then we have a SharePoint site that these folks will have access to, where we can do some sharing of information. We'll talk about if it makes sense to have you all also get into that site, just because there's some state IT challenges around. If you don't use it, you get kicked out after 60 days and then you have to re-enroll, and it's kind of a pain. So it's a question for me of like, is it worth the effort for you all to get in there? It might be, but we'll figure that out. Okay, there's a lot of information, but I was thinking it might be helpful to show, this is data that actually went into our proposal to SAMHSA to demonstrate who are these LEAs, the school districts, and what is their level of need. So as you heard from Melissa, we have Southern Vermont, and that's actually a merged district. Is this your first year merged? Second? Third, okay. So 10 schools, that's our the biggest district, I think, that we're working with, or at least the most number of schools. We have Caledonia Central with 7 schools, and then Barry with 3. And then you can see kind of the student population and some of the demographics of those students. All of them have some level of PBIS, or positive behavioral intervention support, involved. All of them are doing different approaches with multi-tier systems of support. SVSU is the only one who has an identified universal screener for social emotional behavioral needs, as I said, but I think you're trying to spread it to all the schools. The others don't have one yet, but they're really interested in getting one. So that's going to be some early work that we do with them. This is old data. It was what we had available at the time for when we submitted our proposal almost a year ago now. But it's 2021 data, so it probably looks different than what you know currently. This was just a slide to kind of talk about these district community leadership teams. So again, we're in early phases, really early phases with our regions around this. And I think I talked some about this, but the DCLTs, folks have started to, well, I'm going to actually wait to go into that, and I'm going to pull in Mariana and Tracy, but here, this is a available resource for you. We have Wested, who is our evaluator. So they will be making sure that we are collecting the data that we have to collect to report to SAMHSA, but they're also helping us with more of a local or Vermont specific evaluation to give us a sense of, are we accomplishing the goals that we want to accomplish? Not just are we meeting the targets of what we've told SAMHSA we're going to do. They're great. They actually had been our evaluator in our prior round of Project Aware, so they're familiar with Vermont and what we're trying to do, and lessons learned from our last round that they will be continuing to support us on. We have UVM Center for Disability Inclusion, or the BEST team, who's going to be working with us to provide some technical supports to the school districts around multi-tiered systems of support. They also worked with us in our last Project Aware, and worked really closely with a national trainers around what's called the Interconnecting Systems Framework, but just it's a framework or an approach for bringing mental health within a multi-system of support. Last round, we really talked about, like, what is ISF? What is this interconnected system framework? We used all the language of it, and that kind of didn't go over well because it felt like a new initiative to school districts instead of, we're strengthening your multi-tiered system of support around the areas of social, emotional, and mental health. And so this session, we're not going to talk ISF much, but a lot of the concepts are going to be informing what we're doing. And that's where the Cassandra's team at UVM, Cassandra and Amy, are going to be really helpful. And they will consult with the ISF folks as needed in some of that. Then we have a bunch of trainers. So as you might have seen or heard for some of the goals, we want to make sure that both the adults in the school, but also the community, understand suicide prevention. So we're working with Center for Health and Learning around their You Matter trainings for communities and for schools, and they're going to help review protocols that schools and districts have in that arena. Vermont Care Partners is going to work with us to provide some youth mental health first aid training and some teen mental health first aid training. They'll sound kind of similar, but the youth mental health first aid is actually teaching adults about youth mental health topics. What's normative development? Where might things be started to recognize as some mental health concerns? The teen version of mental health first aid is actually for high school students, so that they can recognize needs among their peers, not to take it on, but to know when to seek out support. And that's a newer version of the mental health first aid trainings for Vermont. It's started to happen in some districts, so we're excited to bring that to these districts too. We have Up for Learning, who is a really cool group that goes in and works with students to look at their own school data and to come up with, to identify like what's an area that they want to focus on for some improvement, and to come up with recommendations to give to school leadership. And they can even do like a presentation to the leaders and community members. But it's a really nice way of having student engagement in looking at school climate type of areas of need. Again, they worked with us in the last round, and I think some principals found this to be like really compelling work and have continued to connect with Up for Learning even after the Project Aware funds ended. We have NFI Dave Melnick, who's going to be providing some training and consultation with these school districts as first to figure out what have they done already around trauma responsive schools or transforming trauma in schools, and then see where can we continue to build from there. Because I know some of you have done some work in this area or have sent some staff teams to his courses. But we thought it was really important to make sure we have that lens so that trauma-informed approaches are also infused throughout here. And then Outright Vermont, it will be working with us, again, kind of a combination of providing supports to adults to understand how do we best support the needs of LGBTQ youth, and working with school districts to figure out, are there needs that you have around setting up GSA groups for students? So more to come with that. For all of these trainers, they haven't gotten started yet, but we do want them to start to connect with the supervisory unions to understand, what have you already received for some of this? And like I said, kind of where do they plug in and pick up from there? So not assuming that none of this has happened before, but really trying to identify, what are those areas of need? Okay. This is a lot of information. And I don't want to just talk at you. So we're thinking of this as kind of planning phase, which we've been in, exploration and adoption, and then implementation. one of the expectations of SAMHSA is that there is a local needs assessment that's conducted, and then an implementation plan is put together based on that needs assessment. I'm going to stop sharing here for a second because I want to give some other voices a chance to pipe in here. I'll probably start with Mariana or Tracy and talk about, as we are trying to meet the needs or the requirements of SAMHSA for this project, we also wanted to make sure that it is connected with and meeting other needs that the school districts have in their responsibilities to Agency of Education. But before I pivot to that, I see a hand up. Go ahead, Shalini.
Shalini, yes, thanks.
Shalini.
That's okay. You're going to get
I'm
it.
gonna
I
write
can
it
feel it. I just wondered if I could ask a few quick questions about the slides you
Absolutely.
already showed. Yeah,
Yes.
I just made a couple notes. One, I wondered, is there a limit on the number of people you want to have on this advisory group? I know too many can get unwieldy. I wasn't
Yes.
sure if you already reached your max. I'm asking because I wondered if we could have some. I know a lot of schools in Vermont now have DEI coordinators, or
Mm-hmm.
I wondered if we could have some DEI people from the schools to help inform, interaction with students that may have some intersectional issues. And also, do we have any counselors or mental health providers on the advisory team as well?
So, yep, those are great. That's a great comment. And I was going to ask, are we missing some key folks to be thinking about? And I think it could become quite large. I think some of what we want to think about is, who do we want on the state advisory committee, and then who do we want on those local district community leadership teams? And I think having someone with that DEI coordinator on those teams would be really important. And I think it'd be great to have at least one representative on this team from those. So we are still working with 2 of the other school districts to identify who from their DCLTs could be here. And that's something that we, Mariana and Tracy, we can actually encourage those other 2 to think about, is that someone who could come? Melissa, did you say that's part of your role?
I actually work with ours. So when you said have them have on district team, I'm like, I thumbs up. I've already written down that has to be someone that we have on our local team. But I'm the EL coordinator.
Yeah, thank you.
So I bring that lens.
The other thing I wanted to just give you a heads up about is you had a slide on LEAs, and that slide mentioned one of the data points was about people who have English as a second language.
Yes.
And just a heads up that we no longer use that phrasing, because we found for a lot of people, they know 5 or 6 languages. So kind of suggesting
second
that,
doesn't, yeah.
Yes. So now we say, you can phrase it in different ways, where English is not their first language.
Okay.
Or who have lower literacy in
Multilingual.
English, or multilingual. Exactly. Yeah. Okay. Just another way to identify it, but yeah. Okay, just that. And then on the slide about Vermont training, I wondered if we might add some segment on training about working with students who are not white. And lastly,
let me respond to that and say, it is our expectation for any of these trainers that is a component of their training.
Good. I just worry that I'm noticing that if we're not more overt about it, people don't always understand that that's what's happening.
Yep. Thank you.
The slide on, this is, I'm somewhat new to Vermont, so this might be more specific to me, but I felt like I was, drowning in alphabet soup. I did not know those acronyms.
No.
So I was very confused about a few, and some of them, as soon as someone said something, it clicked. It made a lot of sense. But if you just don't know it fluently, it's a little bit hard to follow some of what's going on, and in fact, grasp the full power of what you've done, because you actually do have representation and inclusion from quite a broad spectrum. So anyway, I would say if there's some way to add a little acronym glossary in there, that would be great.
Yes. And I totally own that it is very easy at the state to speak in acronyms, and I try not to, and I appreciate you calling it out and ask that people continue to do that. So thank you.
And I am taking notes, so I did record each of your questions.
Oh, thank you.
Terrific. I appreciate that. So Tracy, do you want to talk a little bit about how we're trying to connect this project in with other requirements of AOE?
Sure. So the Agency of Education, and here I'll check me on my acronyms. This is annually, and particularly this year, there's an expectation that all school districts submit an updated continuous improvement plan, which you might hear called a CIP or a SIP. Within that continuous improvement plan, there are at least 2 goals that are expected to be written. One is a safe, healthy schools goal. And so we have been, our education quality assurance team, which sometimes is called EQA, they have been working with the school districts, particularly the 3 that are part of this process, to have their safe, healthy school goal align with the expectations of Project Aware. And the intention was both to not be too duplicative in our request of the school districts, but also to have this project support that work, and then to help us learn from this project so that as an agency, we can be looking at how we scale this work and spread it throughout the state, especially beyond the scope of this grant. So just really trying to not do what I used to call parallel play, no, but that it's very intentionally braided and embedded. And at the same time, how do we learn of this work so that we can expand our message about where mental health supports fit within a tiered system of support? So both strengthening the system and then using the information to expand the system and those that are engaged with the work. What are your questions?
Thanks, Tracy.
I just wanted to add too that by embedding this work in the expectations that our Agency of Education has for schools, it also is helping to support the sustainability of our work. Something we learned in the last round to really start thinking about from the gate.
Mm-hmm. Go ahead, Bernice. Thanks for raising your hand.
Mariana, you were just touching on this. I'd love to hear some of the, maybe it doesn't have to happen right now, but some of the lessons learned from the last round of Project Aware and how you all are thinking about utilizing some of those strategies moving forward. And any updates on the needs assessment piece that's part of it? Because I know many AOE and VDH projects require needs assessments at the local level. And so I'm wondering if you all have thought about how to coordinate the needs assessment plan with other programs, initiatives that might also require it to reduce the burden on schools of like needs assessments for all these projects. And so yes. I wonder if there's any chatter related to that, and if not, I'd love to be part of a group thinking through some of that.
Tracy, do you want to respond to that at all?
In addition to my thumbs up. Yes, there is some work that is being done. For example, the continuous improvement plan itself has a needs assessment. So that has been a piece that we've been focused on, but also our technical assistance providers are going to take that work from the continuous improvement process and expand on it to meet additional goals of this grant. Not perhaps there's other needs assessments that are out there that we should be considering as well. But I know there's at least those two pieces that are being coordinated. And then the Vermont MTSS team also has other opportunities for collecting data that will be incorporated, like our Vermont MTSS system screener, our family engagement toolkit and assessment, and the annual Vermont MTSS survey. And to correct or to state an acronym, Vermont MTSS is Vermont Multi-Tiered System of Support.
I think part
Thanks.
of the part of that process that the team from Center for Disability and Community Inclusion out of VVM is going to do is support those tools being used. And also there are a couple of tools that we found were really helpful from that interconnected systems framework training that we got in the last round. Especially it's kind of an initiative inventory. So how can, again, this district community leadership team look at what are the existing resources to meet the needs that have been identified through the data, and so doing that kind of data look first, and then what resources exist and what needs are they meeting, and are there duplications and are there gaps, and trying to really get clear about we do a great job with, excuse me, with this population, but maybe we don't do such a great job with this subpopulation of students. And so what does exist that we know about in our community that we could connect with? Maybe there's a local community resource or a different Vermont resource that could be leveraged. Each of the school districts in Project Aware, we have a grant from DMH to them, and there is some funding within those to support some additional social emotional mental health programming or activities. And so if there's a need for more kind of training about how do we work with non-white students, for example, like really specific, we want to bring someone in to talk with us about this, that could be purchased through those funds. And that's part of the kind of needs assessment process and then the implementation plan. So now that we understand where our strengths are and our resources are and where our gaps are, what are we going to do next? So there is, there's kind of like required activities of the project, and then there's this room for how do we adapt this for the local context for each district? I feel like there was something else I was going to add to that, but were there, Marianne, other tools out of the interconnected system framework that might come into play here?
No, I was thinking of the initiative inventory too. I think that's a big one because schools, it's very popular to grab onto new initiatives and more initiatives. And so they just get inundated very fast, and they don't always clean up the ones that they're no longer using or they feel like are ineffective. So that's, and sometimes it's great to map that out and be like, look where all your energy is going. Like, you guys, this is not sustainable. So I think that's a really helpful piece.
They mentioned this phrasing, working smarter, not harder, right?
Yeah.
So that's one of the approaches they try to take. Go ahead, Tracy.
I would also add that both a lesson learned and a tie into how we're using the data to understand the needs is that the trainers, I think Laurel mentioned earlier, have not started their work yet because we wanted to really look at what is your data indicating is your needed training, and not, oh, that sounds cool, let's do that. And all of these different trainings are available throughout the project. And so it would also help us to really prioritize what needs to happen first, rather than like, I just heard this phrase this morning, random acts of improvement, very intentional improvement. Because there's lots of things you can work on, but what's your priority and what data do we have that would support that being what we do first, second, third?
I
Thanks,
think Laurel
Tracy.
touched on this too in the presentation, but I just wanted to, I keep trying to highlight this for the LEAs and the DAs, that are education agencies and our mental health agencies, that we have all of these trainers and different folks with professional scopes coming in, but really the sort of thesis of this work is, how do we make sure that this is all one system, and how do we make sure that those trainings, these are not just sort of one-off trainings, but instead it's part of this whole package that is interconnected. So how do we make sure that our Outright Vermont trainings are timed right, so that they are feeding off of or building off of, you know, the You Matter and suicide prevention trainings, and how do we so that it's one sort of cohesive work rather than different pieces.
Bernice?
Sorry, I feel like I'm taking up too much airspace, but this is also exciting. Tracy, it was really helpful to hear about the continuous improvement plan and all the other MTSS related data collection tools that you all use. I'm wondering if, you know, you're working with many wonderful trainers, and I know many of the folks in the CDCIs at UVM, they're great partners. I'm wondering if there's space to add into that first year, and they're probably already thinking of doing this, in addition to the needs assessment from the continuous improvement plan. Is there space to talk to folks on the ground? Because sometimes we don't know what we don't know, right? And if there are groups of folks that are unintentionally and intentionally silenced from the data, that can skew like what needs are around. So, you know, Up for Learning is very strong in youth voice. So if there's a way that during that first year, we can, at the district, using the district leadership teams, to try to catch some more street data on what folks on the ground are saying they need. And I'm happy to support some of that thinking, because in our community schools work, it's been really important to talk to parents, to talk to students, to talk to folks in different facets of school stakeholder groups to understand the need related to mental health. And that might help triangulate some of the existing quantitative data in ways that can help inform. So I'm sure folks are thinking of that, but I just wanted to throw that out there as something to consider.
Yeah, I love that. And I'm sure, Nancy, your ears are probably perking up too. I mean, there is a real aspect around the family engagement piece here. But I think the how is where there could be some guidance and support with the districts.
Yeah, I would say that that was an area of learning in our first Project Aware, and that just how complicated and challenging it is to do that work. And so we're still, I feel like, trying to feel our way through a plan that can really help us get at that.
I would also add that that is one of the really cool values, I think, of this advisory council, and we didn't have this as part of the first Project Aware, in like holding us accountable. And maybe you'll get to this, Laurel, but are we doing what we said we wanted to do? What should we be considering that wasn't on our radar when we wrote this, you know, et cetera. So I really value the voices that'll be here.
Yeah, me too. I think I'm already excited about this aspect of it, because it just, we can get so like in the zone of doing what we know we're going to be doing. And it's just really helpful to kind of have that broadened out. Like, have you thought about this? So that's a great segue. I'm going to reshare my screen, and I just want to talk about the role of the advisory committee. And I want us to come to some kind of agreements too about what is the role here, not just how do we function together, but how do you see the role of an advisory committee as you agreed to hop onto it. So, okay. It always takes me a second because it closes you all down when I start sharing a screen, and I want to be able to see you still. So bear with me.
Laurel, I was just noting that in the agenda, we had core activities and timeline.
Oh, yep.
Before roles of the advisory committee. So I didn't know
Sure.
if the two were combined or if we
Yeah,
missed one.
I kind of, this is the alphabet soup slide. I don't know that I want to go that deep right now, so I kind of been skipping over it. I can talk really quickly if you'd like about what SAMHSA wants us to collect for data and then get into the advisory committee. So thank you. I'll back up a minute. These are the federal government's indicators that they want us to collect. And you can see I didn't finish my slide because I'm like trying to get it done. We do have Vermont targets. I haven't plugged them in here yet. But just to really kind of high level, we have to collect data from the different sites or the LEAs and regions where we're doing the work, as well as from the state level. And so one of the indicators is about partnership and collaboration. So they want to know how many new partnerships or collaborations were formed because of this project. That can be at the state level collaboration, state to local level, or local to local level. And so there's a description here, but there's a lot more detail that our evaluators are going to hold around what qualifies to be counted under this. They want us to report about the trainings that we do, and some specifics about who was the target audience, what was the focus of the training, how many people received it, what regions were they in, and then not just how many people did you train, but did it actually help shift knowledge, attitude, and beliefs? And it cracks me up that this is an NAB1, but it's knowledge that starts with a, okay, whatever. So NAB1 is knowledge, attitude, and beliefs. So for all of these trainings, there has to be an evaluation, essentially, that we get a sense of what did this shift potentially for people, because we want the trainings to be valuable. And then the next three are really the core of kind of the impact that we want to see. So are we screening students? How many are we screening? And then of those screened, how many were referred for mental health supports? And that we will track both internal referrals, meaning within the school or district system, and then external referrals, so to other community entities to respond to those needs. And now here's the kicker. How many kids who were referred actually received the support that they were referred to? This last one about access, I think we can all agree is probably the most important, and it's also the hardest to collect. It's where we really struggled with our last round of Project Aware, because school systems aren't set up, that we experienced with the ones we were working with then, to actually get this kind of feedback loop to know, okay, we referred this youth, have they actually started the service? And so that's an area where we are going to be doing some work with schools to figure out, how do we collect this? And you have your partners in the designated mental health agencies. There can be a structure around how that communication happens, but even with other community entities you might be referring to, how do we get a sense of who actually received the service? It's easier to do internally, but even then I'm not sure the data is collected. So what is that data structure? We might start off in a clunky way, and our hope is that we can help schools set up structures where they can continue to track this beyond the life of this grant. So that's the data. Any questions with that? Like I said before, this is just like the data reporting to SAMHSA. There's a lot more that our evaluators are going to be helping us to look at around just what impact is this project having? How are the relationships? Where are the challenges with that? And the strengths with that? Like all kinds of other kind of qualitative evaluation work that will happen. I do think it'd be really good for us to invite WestEd, our evaluator, to come to this group, and I'd like them to come periodically to present the findings as we go through the project, but also just to come and talk about what their evaluation approach is, and how do we make sure that there's also cultural competence within an evaluation process like this. So more to come there. A lot of words on this slide. I thought I'd share with you what SAMHSA's expectation of us is for an advisory committee. It's pretty high level, like you shall have one and it shall have these entities. We've already talked with them about we're not having students on this committee. We're going to do it in a different way. They totally understood and appreciated that. On the right side with the bullets, this was really me kind of putting out to you all, like, this is what I think can be beneficial of an advisory committee, but I also want to hear from you. So we want to review with you, what is this project? What are the goals? What's our plan? And we are looking to you to help us kind of stay aligned to that, but also make sure, I'm going to phrase this in a way that we're using as we interview people, like, I don't just want to meet the goals of the grant. We're trying to use these federal resources to meet the needs of Vermont, right? Like, that's the purpose of this. And so, yes, we need to comply and make sure we're fulfilling our requirements with the feds, but ultimately we sought this out because of the need that we saw here. And so we want to stay aligned with that. And we want to make sure that at the state level, we are understanding what the local needs are, and that, you know, we're informing each other state to local, so that it's not a state down to local, but that there are some things at the state level that we also want to see, and there are some things at the local level. And, you know, it's going to be this kind of process together around figuring this out. I think the beauty of this is, at the district level, you're testing out some of this stuff, and then you're saying, you know what, reality is this is a real challenge, and we need to figure out how to do this differently. And that's going to inform at the state, and you know, are there policies that need to change, or other, you know, resources that we need to be tapping into? Is the quality process something that we need to look at? All of that. So there's that. Like I said, we want to share with you the data and then get your input on it, and program updates and some of the reports. We want to hear from you just about how are we thinking about this? Where are our blind spots? That's already started today, so I really appreciate that. And then how do we stay connected with other initiatives and parts of the system, right? Like, we can't take on everything under this project, but we don't want it to exist in a vacuum. And so we really do want to know, like, what, I mean, we've all worked at the local level too, and I know what it's like to have these different demands coming at you and to feel like I can't meet all of these, and I just wish they would align. And so that's part of what we're hoping to have some input around here. But those are my thoughts. So what, from any of you, what do you also see an advisory committee role being? Go ahead, Karen.
So, you know, I hopped on this advisory committee, you know, again, because we support parents of children with disabilities who are usually on IEPs or 504s. And I see Melissa's comment about ESTs. And, you know, we've just seen such a severe uptick of services, mental health services not being provided for a variety of reasons for our kids. And, you know, so I sort of in line too with, I think, what Melissa was saying, you know, there can be confusion with teams on how that mental health support can be written into that section 504 or, you know, IEP. And then, you know, the whole interplay between the mental health services from the DA and the schools and, you know, Success Beyond 6 and all of those pieces. So, you know, and I realized that whenever you do these projects, it's a, you know, it's a cohort. So you have specific school districts, and we're statewide. We work with parents all over the state. So, you know, I'm not sure whether any of the information that comes out of this can be, you know, shared with parents generally. I mean, I guess I hope that I'm able to learn more to be able to give those resources to the parents we work with, as well as, you know, it could be to get more guidance on how teams can fit those services into their children's existing IEPs and Section 504s.
Thanks, Karen. That makes a lot of sense to me. What else? Thanks, Shalani.
Yeah.
Thanks. Yeah, just wanted to say I'm sorry I have to leave early, and I'll see you all next time.
Great. We'll be in touch. Other thoughts?
Could I go back for just a minute, Karen? Because I apologize, half listening and half reading the chat at the same time. I want to make sure I capture what you said in the notes, and what I wrote was, what are the connections between this work and students with IEPs and Section 504 plans? But I feel like I'm missing something.
So I think it was two things. I think
Okay.
I was referring to Melissa's measurement piece that can also be looked at within existing IEPs and Section 504s, but
Okay.
also just that there can be a lack of knowledge around how those mental health supports can be put into that Section 504 or IEPs.
Okay. Thank you.
And I think I heard you say, Karen, are there pieces from this project that might be informative for all parents,
Right.
not just those
Yes.
connected to these districts, and that you would
Yes.
try to bring that back? Yeah.
Mm-hmm.
Mm-hmm.
Melissa.
So with that in mind, Karen, I really appreciate that you brought that up, and we have Keely here, and I don't know if she'd want to speak now, but at some point, I'm so happy that she's on this team, because the big thing that we see as a need, and Karen, you brought it up, is we want to work on that communication with parents. And so we work in this vacuum of all of what we think are great ideas for communication. But Keely, you're here at some point, maybe not today, but that's what I'm wanting to hear more and more of, our ideas from our parents and from our community of different ways that you want that communication to be done. Because we're always just trying to make that more and more effective. So Karen, thanks for bringing that up, and Keely, thanks for being here.
Sure. Thank you. And I have a lot of thoughts. But I think it's important maybe at this moment to share so some of my reasons for saying yes when Kate reached out. So for those, some of you know, I know Laura, you probably know, and others may not. So I have worked in community mental health for a very long time, like 20 years. And so I have that kind of background. Mental health is really important to me. I live and work in my community. And so my community is really important to me. And I have 2 children with very complex mental health needs. And they, you know, one's in school in Bennington, and one's in school in Rutland. And so working, living this sort of world kind of all the time. And so I have a lot of passion, and even having been, you know, I have had many experiences where even working in this field and living in this community where as a parent, I don't even know what to do or say or how to navigate the system, right? And so I think, you know, there's a lot of things that change when you're a parent versus a professional. And so I just want to, in full disclosure, share those pieces. I am a licensed mental health counselor, and have, you know, I worked with kids for a long time. I work with primarily adults now. But this is an area of extreme interest for me. So I just want to kind of share that, and I have a lot of thoughts on that communication piece as well as other things. So
thank you, Keely.
Thanks. Yeah.
Really appreciate you being here.
Yeah, thank you.
I think it's, you know, my hope is that as part of this committee, you know, we bring our whole selves to this. And so I appreciate you sharing that aspect.
Yeah, absolutely.
Yeah. So along those lines, I did, and it's unfortunate we've lost a couple of our members. But like I said, I want to revisit this because we'll have other people joining the next time. What are some group agreements that are important to you? And what I mean by that is how are we together in these conversations? And so some people call them group norms. I like to call it group agreements. You know, how can we come here and be a part of this, knowing that we come from different backgrounds, different experiences, different disciplines or whatnot, and be a committee that can function well and communicate well and feel safe with each other as well. So what's important to folks? And it can be simple things like some people have started using the raise hand feature so that we're not talking over each other. I really appreciate that. So I would encourage that we continue to do that as much as we can, and recognize that sometimes maybe someone's really passionate about something and doesn't, and you know, we can be okay with that on occasion too.
I'm raising my hand by phone, but I just wanted to say that I was really, I appreciated Shalini's pointing out some of the changes that we can be making, and just sort of calling out some either language that we're not using anymore, or making sure that we're being inclusive with, you know, like not using acronyms or explaining our acronyms, at least. Yes, in the state and in education and in mental health, we can get really, really good at using acronyms. So I really appreciated that, and I feel like it makes a space that's easier to communicate in.
Agreed. Thanks, Mariana. Tracy?
I realize this will take a little time as we get to know each other, but I always value candidness and being able to, well, I guess I would say Shalini would be an example of, you know, feeling like this is a safe place to disagree, because that may happen, or see different points of view, and yet we are all here with the same goal in mind.
Thanks, Tracy. What else?
I added mine to the chat, Laurel. I don't know if that was an option. I'm sorry.
Thank you. No, that's fine. So strive to support, not supplant. Do you want to elaborate at all? Or that's great.
I would say that it has been my experience with groups that are coming together that everybody is bringing their great ideas, and we've just all been admiring that. And I that's why I'm here. But sometimes we can go off on a different path, as Robert Frost would say. And then we get lost in the woods instead of action, and or the things that are already being done, which we could prove are effective and should be proving are effective to continue doing in progress monitoring. It can be, and somebody mentioned this, you know, the shiny object. The shiny object might be awesome, and yet shouldn't we see what we already have before we just start going after that shiny object? With the size of the district that I'm in Southern Vermont, although I always want to preface by saying it is Vermont, so you know, I always say we're so big, but it's a mighty little state. It can get very all over the place with 10 schools, and the consistency for families and parents, and ultimately those children gets lost when we start going off in different directions. So I think when I say that, I just want to always be acknowledging what people are already doing, and again questioning them to say, so how's that working out for you, and what proof do you have that it's happening is also very important. but just throwing it out and not giving it the time and effectiveness. The first thing that I would say after almost, wow, I think we're up to 8 years of working with Dave Melnick. And we finally have a really solid cohort of trauma-informed people in every building who are now ready to go out and be the coaches with professional learning next year. And we have several dates. Just that's what they're going to do. That's what everybody's going to be doing. It's all SEL. And we've got internal coaches who then in between those times of PL could be accessed within the buildings by people that need that extra scoop of something and make it solid. So I share that with you to kind of say what's going on, but I also share that with you to say how long it took to get that lifted. And I know there was the thing that we don't talk about that got in the way, but all of these things do take a little time. And I'm always fearful in education that we go off on another route before saying, is this really effective? And I'm always willing to say, hey, it's not working. You got to do something different. But I want to give us the time and space to do it. So thanks for hearing my, it's not a rant. It's more of just, I don't want to spin wheels because we're all here because we know that, and no one said it, but I'll say it. The community that I grew up in is in crisis, and the families and learners, they need help. And there's a lot of good-hearted people that want to help, but how do we get systematically there? And that's why I'm excited to be here.
So well said. Thank you, Melissa. Sorry. Go ahead, Nancy.
I would like to think about how we use chat. I'm a person that if somebody's talking and chat's going on, I get distracted. And I often turn off chat so I'm not distracted. But I would like to make sure that we pause to read chat so I'm not feeling like I'm missing something. So that's a need. And my other learning style is visual, and I'm just thinking about all the different players we have involved, if there might be some way to visually represent that, and would that be helpful to other supervisory union, the supervisory unions involved, and the trainers, and how you talked about making sure it's coordinated. Those are my two thoughts. Thanks.
Thanks, Nancy. I share the challenge with trying to keep up on chat, but also stay in the conversation. So I appreciate those comments. And I think we're going to try to kind of co-facilitate to some extent, but as a facilitator, I will try to be more intentional and pausing and maybe even reading aloud the chat. And I invite people to actually have it in the dialogue also, so that we don't have a separate conversation in chat necessarily from here. I think chat can be helpful with sharing of resources, name pronunciations, those kind of things, because it will live on. I think it is hard to have two parallel conversations going personally. Kate.
Sorry, I'm not super familiar with Teams, so figuring out where the buttons are. I'm just filled with appreciation for the contributions and the kind of depth of thinking from everyone. All that has been suggested in terms of how we're getting off the ground with this sounds great to me, and I think to echo some of what Melissa shared around efforts to really try to stay part of what I heard from you, Melissa, was sort of the importance of trying to stay focused and true to our mission. And I think for me it connects back to the advisory board goals that Laurel set out, and I hope that we take our time with looking at those goals. I had wondered as we were discussing that if it made sense to sort of overtly or explicitly add in there goals around equity and ethics. And I think that they are implicitly in there. And I think, but it'll be important, I think, for us to really look at those goals, because that's going to be our barometer, right? As we do our work, is to be continuously revisiting those and saying, are we staying true to you know, to that 30,000 foot vision of this work, and helping advise the teams who are doing this work on our perspective on that.
Thanks, Kate. I just added that into the list. That's really helpful. I also I would love your thoughts about frequency of meeting, because I think it can be hard to only meet on a quarterly basis. It's pretty drawn out. Like there's some big gaps in there, and it's also a big ask of you to add this to your existing roles. And so we were trying to figure out the balance of how much time commitment can we ask of you all, while also still having it feel like it is really truly of value and contributing to our thinking and planning, and able to impact the work that is happening. So I don't know if you all have thoughts about that. It's partly why I wanted to do an hour and a half, so that it didn't feel really rushed within an hour, that we had time for some dialogue. But again, that balance of like, I know people's schedules are maxed. Go ahead, Melissa, thanks.
I definitely would commit to meeting more. I would just ask how the team felt if on occasion our project aware coordinator would represent the district on days when we have to kind of share that role as a representative of the LEA, or if the team would have any issues with that, then I could commit to doing more than quarterly.
Other people's thoughts about that, or the broad question? I think my initial reaction is I don't want to have too much swapping out. And yet if we know that, like at the state, we're going to be connecting with Lindsay, your coordinator. So we'll know her, but I want to make sure that the group also feels comfortable that there might be this kind of swapping. Thanks, Tracy.
I also wonder, in response to what Melissa posed, is if we make a commitment to having agendas ahead of time, you know, we're recording the session, we're providing the slides and the minutes afterwards, would there be the same need as having a substitute?
No, Tracy, you would have solved it. Thank you.
Any other thoughts or input about frequency? Or partly I'm asking because I do want to get out a recurring meeting time. So it is a question of that recurrence. I had said quarterly in our initial communication to you all, so I think we'll go with that. But if people feel strongly about having it more frequently, we could do like every 2 months instead. It wouldn't have to necessarily be a monthly thing. Karen.
Yeah, I mean, I'm not going to proffer an opinion because I don't know how quickly the scope of work is going to move. So, I think like everyone else, you don't want to go to meetings just to go to meetings.
Yep.
So, I do leave it to those of you who manage that overall piece to determine when it might be. And I suppose if something came up that was important as a part of it, I'm not sure whether we would do, like a subgroup if it's
Mhm.
something that's not pertinent to, everyone. But again, not knowing how the scope of work is actually going to break out, I don't know whether that makes sense either.
Okay, thank you. I think for now we'll stick with quarterly. I will possibly have our administrative assistant, Joanne Crawford, help in finding an ongoing time. I'm curious if Fridays might be an okay day, or just because that happened to work out for this one for those who were able to join today. So we might go with that. Okay, I see some thumbs up and nods. Thank you. But we'll get something going on the books. If we were to do it quarterly, I think this would put us into July. A lot of you deserve vacations, and I'm hoping you're taking some time this summer. But we'll see kind of where that comes out. My guess also is that perhaps the end of June is also a more challenging time because of the wrapping up of schools. So the summer months are always kind of the challenging one with people's schedules. We'll put something out there recognizing we will miss some of you. And like we said, we'll try to record this. We'll get it out to folks, and you have points of contact to communicate. Okay, one other group agreement is ending on time, starting on time. So I'm going to wrap us up. Thank you all. It was great to hear from you and to have you here today. Really looking forward to continued conversations, and we will get the information out to you from today. Great. Thanks all. Bye.
Thanks so
Thanks,
much.
everyone.